Back to you talking about your health, and it can be a painful experience when many women deal with in fibroids. So Dr. Eric Hardee joins us now to tell us about a procedure that could help many dealing with this condition. So first of all, thank you so much for joining us this morning. And can you tell us a little bit about Houston Fibroids and Texas Endovascular first?
Well, Texas Endovascular, we're an outpatient vascular practice specializing in minimally invasive image-guided procedures that can replace a lot of traditional surgeries.
That sounds like it's going to be a lot better for recovery for some of these patients. So I understand that you offer that treatment, uterine fibroids. Can you tell us more about that and your specific approach?
Well, uterine fibroids are one of the most common tumors that females experience, and traditionally in the past most women have opted for hysterectomy or other surgical procedures where fibroids or their uterus are removed. That leads to permanent scars, long downtime, and people are looking for less invasive ways to treat their symptoms. Only about 35% of women actually have symptoms, but once you have symptoms, they typically get worse as time goes by. We offer an outpatient treatment that eliminates all the fibroid symptoms, and most ladies are back to work in around 7 days. The treatment revolves around shutting the blood flow down in the fibroids, and we insert a very tiny catheter into an artery of the body. The catheters are actually so tiny nowadays, we insert them through the wrist.
Oh, wow.
We guide it down into the pelvis. We do an angiogram, map out all the blood vessels in the pelvis, and then inject these little tiny particles that permanently block all the blood flow to the fibroids. Immediately, the fibroids begin to shrivel up, and the symptoms are typically gone in most ladies about 2 to 3 months.
That is incredible. I think something you just mentioned, only 35% of women even feel that they have pain. That
they have symptoms. Fibroids are extremely common. 80% of African American women and 70% of Caucasian women will have fibroids by the age of 50. Only 35 to 40% will have symptoms, though. And these are benign tumors. You don't really need to treat them unless you have symptoms.
Yeah.
And once you do have symptoms, they usually get worse as time goes by.
Sure, yeah. I have some friends that have experienced that pain. So you mentioned the stats there with the percentage, but are there more patients that are more at risk for a fibroid?
African American women are most at risk, 80% by age 50. Caucasian women around 70%. Hispanic women and Asian women are somewhere in between.
Okay.
African American women are particularly at risk because they're more likely to develop larger fibroids and become more symptomatic.
Oh, wow. That does not sound great. It's a good thing that we have this procedure. So what happens if a woman waits, though? Will the fibroids shrink on their own, or do they need...
Typically by menopause, when women go through menopause and their hormone levels drop, the fibroids can shrink and the symptoms can diminish. But we're finding nowadays that with hormone replacement therapy and other things that fibroids are not regressing in everybody. But most women that we treat are typically in their 40s, or they're through having children, they're profoundly symptomatic, and they're looking for a way to eliminate all their symptoms without having to go through surgery.
I was about to say the recovery time on this procedure sounds so much better.
Most ladies are back to normal activity, back to work around 7 days after the procedure. Some actually go back to work earlier, but 7 days is about average.
That's incredible. Where can patients go for any more information on this? If they're...
Well, our website is very informative, HoustonFibroids.com. We have a lot of information about the procedure, other alternatives. We have frequently asked questions, and they can also find us on the website and call our office if they want to talk more.
Well, Dr. Hardee, thank you so much for all that information. I hope a lot of people at home found that very helpful. Minimal invasive operation for people to get. Hopefully takes a little bit of that pain away. Again, thank you so much for joining Houston Happens. We'll have more after the show, after the break.
This is a paid advertisement for